With the death toll approaching 700, the latest outbreak of the deadly Ebola virus in West Africa has the distinction of being the worst in history. For months, the outbreak had been confined to the nations of Guinea, Sierra Leone, and Liberia. But last week, Nigeria confirmed its first case after a man collapsed in Lagos Airport following a flight from Liberia. That man, who quickly succumbed to the disease, was reportedly an American citizen with family in Minnesota, where he planned to travel next month. 2 other Americans have also been affected. Dr. Kent Brantley, a medical missionary from Texas, and Nancy Wrightbull, an aid worker from North Carolina. Both contracted the illness while working in Liberia, and both are in isolation and said to be in serious condition. Ebola has no known cure and a fatality rate upwards of 70%. And although the Center for Disease Control has downplayed the risk to Americans here at home, the rising death toll and geographical migration of the virus has some worried that an Ebola outbreak is just one international flight away. Joining me for tonight's Q&A is Gillian Turner, who served in the White House National Security Council and currently works at a national security strategy firm where her regional focus is on Africa. Gillian, what's the latest on this and how serious of a threat is this?
Hi, Allison. I have to say that without a doubt, this is the worst case of an Ebola virus outbreak that the continent of Africa has ever seen. What's happened in previous years is that we've seen outbreaks on a much smaller sort of periodic scale. For example, 2012 saw an outbreak of the virus in the Democratic Republic of the Congo, which resulted in the infection and death of less than 100 people. The same year saw an outbreak in Uganda, which resulted in the infection and death of less than a dozen people. So what we're seeing here is really unprecedented in scope. And I also want to point out the significance of this past weekend's spread into Nigeria, as you mentioned, cannot be overstated. Lagos is an international hub, especially for Americans doing business in Africa. Several American cities have direct flights on a daily basis to Lagos. So really, this outbreak is a reminder that Africa's problems are the world's problems, and the international community needs to get involved and needs to pay attention to what's going on.
What is an immediate step that you think the international community should be taking right now?
What we've seen lately is that most countries at the national level have sort of stepped back and followed the lead of international organizations like the UN's WHO, the World Health Organization. But what we want to see is some more leadership, robust leadership on the national level, particularly here in the United States. In a couple of days, heads of state from these 4, plus about 50 other countries, are going to be converging on Washington, D.C. for President Obama's first ever African Leaders Summit. The people attending this summit are going to want answers. They're going to want to know that, number one, that the United States is aware of what's going on the ground. Number 2, that the United States cares. And certainly number 3, that we're willing to get involved on a tactical level on the ground.
Well, there are a lot of diseases in Africa. As you mentioned, in 2013, there was a meningitis outbreak in an area that the World Health Organization calls the African meningitis belt. It's in sub-Saharan Africa because it is such a prevalent problem there. And all of our viewers will remember that George W. Bush issued PEPFAR to deal with the issue of the AIDS epidemic. What type of policies do you think the U.S. should be looking at when it comes to dealing with these health problems that are rising in Africa? Should we be seeing more things like what we saw with PEPFAR?
I think definitely. I think that the United States and the international community at large needs to pay close attention to the spread of infectious diseases across the continent of Africa. What particularly rankles about this issue is that these are countries that are already beset by a myriad of challenges and vulnerabilities. You know, among them, the threat of homegrown terrorism, lack of education and infrastructure, and extreme poverty. So really, when viewed from that perspective, this is another issue to add to the already overwhelming roster of things that these countries are dealing with. And I think that it's important that partnerships with countries like the United States and others are really strengthened to try and tamp down as much as we can on the spread of diseases, you know, that have sort of long since been eradicated in other parts of the world.
Well, Gillian, thanks for sharing your expertise with us today.
Thanks, Allison.
As the fighting in Gaza between Israel and Hamas continues, so do protests around the globe. Unfortunately, some of those have taken an ugly anti-Semitic turn. Buck has the details after the break.